Good morning, this is Dr. Deepa from SRM Dental College, Ramapuram, Department of General Pathology. Cancer is a leading cause of death worldwide, because of which there is an increased demand for early diagnosis and treatment. Among the various diagnostic procedures, one is tumor markers. So today, let us see what these tumor markers are. By definition, tumor markers are those substances that are released by cancer cells. Not only cancer cells, but also are produced by the body in reaction to malignant tumor or due to various benign conditions also. So normal cells also produce tumor markers but in much lower level when compared to that of cancer cells. For this reason, elevated level of this tumor markers can be a sign of cancer. The purpose of tumor markers are many. Among them, few of them are listed out here. Firstly, to monitor progress of a cancer. The most common use of tumor marker is to follow a known cancer. In this setting, a decrease in level of tumor marker may be a sign that a tumor is decreasing in size, whereas an increase in the level could mean the tumor is progressing and not responding to the treatment. To monitor for cancer recurrence. With some cancers, an increase in a particular tumor marker may indicate a recurrence of the cancer following treatment. To diagnose cancer, tumor markers are not only used alone to diagnose cancer but may provide clues as a part of the diagnostic procedure because of its various limitations. It can be used to screen for cancer. An example of tumor marker used for screening is the PSA test for prostate cancer. It can also be used to help stage a tumor. In some cases, tumor markers may be helpful in determining which stage the cancer or the tumor is in right now. So it can help in diagnosing metastasis. Metastasis, we know it is a distinct spread of tumor. So if a particular tumor marker level is very high, it may suggest that a tumor is not only growing but has spread to other region of the body. Then it can be used to estimate prognosis. In some cases, higher level of particular tumor marker may indicate a poor prognosis. Then it is used to determine treatment choice. Gene mutations and other genomic alteration may be used to determine if targeted therapy is indicated. Then it is used to predict complications of cancer. So, in this way, tumor marker has a wide variety of purposes. So, tumor marker measurements. To measure the tumor marker, the sample of the bodily fluid or tumor tissue is sent to the lab to measure the level of the tumor marker. With protein tumor markers, tests are most often done on blood, but they may also be performed on urine, stool, cerebrospinal fluid or peritoneal fluid or even pleural fluid. So with genetic biomarkers, tests may also be done on tumor tissues or through a blood test that looks for circulating tumor cell DNA. So these tests are often most valuable when repeated to look at the progress of a tumor over time. If the lab test is abnormal, which means that the treatment should be altered or it should continue. If the tumor marker is within normal limit, it is understood that the patient is responding to the treatment. So in this way, the tumor markers help for prognosis and the measurement of it is done this way. As you can see in the picture, there is a list of common tumor markers. So some tumor markers you can see are associated with just one cancer while others are associated with multiple cancers. Often elevated biomarkers can be a sign of non-cancerous conditions as well. That is, not only do cancer cells produce tumor markers, there are certain non-cancerous conditions which will also cause increase in tumor markers. So you can see a CA125 test measures which increases in the blood. This increase is generally seen in ovarian cancer, and this is the most common cause for elevation of CA125. But this CA125 test isn't accurate enough to use for ovarian cancer screening because many other conditions can increase the level of this protein, such as cancers of uterus, cervix, liver, colon, breast, lung, and even certain non-cancerous conditions can also elevate CA125, such as in case of menstruations as well as in uterine fibroids. Next, coming to CEA, that is carcinoembryogenic antigen. So this is a glycoprotein which is associated with colorectal cancer, but it is also present in other types of cancer. For example, lung cancer, skeletal metastasis, breast cancer. Not only in cancer, but certain non-cancerous conditions like in liver diseases, in chronic kidney disease, pancreatitis, and case of smoking. So next, coming to AFP. AFP stands for alpha fetoprotein. So this is a protein which is made in liver of developing baby. Generally, the AFP level are usually high when a baby is born, but as the baby grows up, it usually falls to very low level by the age of 1. So healthy adults should usually have very low level of AFP. But if there is an increase in AFP level, it shows there is a sign of liver cancer or cancer of ovaries or testicles, or in non-cancerous conditions also you can see an increase in AFP, that is in liver disease. So next is the prostate specific antigen, that is PSA. This tumor marker is generally seen for in prostate cancer. So this antigen is found in low level in all males, but an increase indicates that there is a prostate cancer. So next, coming to HCG. This is an organ which is made up of alpha and beta subunit that is produced by placenta, and it is normally measurable only during pregnancy. But some abnormal tissue or tumors and cancers can also produce HCG, making HCG test useful as a tumor marker. Moving on to limitations of tumor marker, there are a number of limitations using tumor markers to monitor cancer. Some of these include absence of tumor markers for some cancers. So all cancers need not necessarily produce tumor markers. There are some cancers which do not produce or result in production of any tumor markers. In such cases, it can lead to wrong diagnosis. Next is false negatives. In some cases, particularly early stages of cancer, tumor markers may not be elevated, leading to false negative results. False positive. With some tumor markers, there are a number of benign conditions which can increase as well. For example, CA125 may be increased with ovarian cancer, but it can also be seen in uterine fibroids, pregnancies, and in some liver diseases. So, false positive can also cause a wrong diagnosis. Next is timings. The level of tumor marker at one point may not necessarily reflect the status of cancer. For example, if a tumor marker is responding to a treatment, it may take some time for the tumor marker level to decrease. Or if a lot of cancer cells are dying, levels may even increase for a period of time. So this cannot be considered as increased tumor marker level or decreased at that particular time. So these are various limitations pertaining to tumor markers. So this was a brief note on tumor markers. So tumor markers cannot be alone used for diagnosis, but it can be used as an adjuvant for diagnosis and also useful in prognosis. So with this, I end today's session of tumor markers. Thank you.